such as a piece of medical equipment, is often performed in the hospital setting. When performed incorrectly, this may lead to injury of the shoulder, spine, and hip. In this video, we will use a box as an example to demonstrate the correct maneuvers for moving any heavy loads. Start by inspecting the surroundings of the box for any obstacles. Stand with 2 feet close to the box at shoulder width. Lower the body by bending both knees, keeping the upper body straight. Do not bend your back. Hold the box in opposite corners and assess the weight of the load. Straighten both legs to stand up. Firmly hold the box with both hands. Keep your chin up, looking forward, maintaining a straight back. Keep the center of gravity close to the body by bringing the load close to the waist. Again, keep your chin up, looking forward. So, to summarize, when moving a heavy load, assess the surrounding of the load, stand close to the load, lowering the body by bending both knees, assess the weight of the load using both hands, stand up with the load, keeping a straight back and your chin up, hold the box close to you and lower by bending at the knees, and remember to keep a straight back at all times. Moving a patient up a bed. Many patients with reduced mobility, such as those recovering from an operation, have difficulties moving themselves up the bed. In this video, we will teach you the correct maneuvers to move a patient up the bed. For this maneuver, you will need 2 carers and a sliding sheet. Start by washing your hands. Introduce yourself and explain to the patient that you would like to help them move up the bed. After gaining consent, move the bed away from the wall and remove the headboard and side rails. Put the brake on and raise the bed to waist height. Stand on either side of the bed with the sliding sheet ready. Ask the patient to bend their right knee and put their right hand on their left shoulder. Help the patient to roll onto their left side. Explain what you are doing and reassure them. You must be standing next to the bed with no gap to prevent the patient from falling. The other carer folds the sliding sheet lengthways and places it underneath the patient's back. Roll the patient onto the opposite side. Pull the sliding sheet so it is flat on the bed. Lie the patient flat and check that they are lying in the center of the sliding sheet. If not, it will need to be repositioned. Choose handles that hold most of the patient's weight, at the level of the shoulders and hips. Stand with your leading foot pointing towards the direction of travel. Get a good grip on the selected handles. When sliding the patient, your knuckles should be on the bed, not lifting upwards. Rehearse the maneuver with your colleague. Now you are ready. Slide the patient up the bed using a coordinated movement. Check that they are far enough up the bed. If not, repeat the maneuver. To remove the sliding sheet, take one corner from under the patient's legs and pull it so it slides against itself to come out from under the patient. Replace the headboard and side rails, lower the bed and move it back into position. To summarize, to move a patient up a bed, wash hands and gain consent, reposition the bed, remove the headboard and side rails, roll the patient to one side, placing the sliding sheet underneath the patient, roll the patient to the other side and pull the sliding sheet through, ensure the patient is lying centrally on the sliding sheet, place the hands and feet at the right positions and rehearse the sliding maneuver. Slide the patient up the bed. Ensure the patient is comfortable. Remove the sliding sheet by pulling on one corner. Replace the headboard and side rails and reposition the bed. Hoisting a patient. Some patients may be so mobile that they have difficulties moving at all. Such patients require the assistance of a hoist to mobilize. In this video, we will teach you how to use a hoist to move a patient from lying in a bed to sitting in a chair. For this maneuver, you will require 2 carers, a hoist, and a sling. Start by checking the service, power, and working condition of the hoist. Check the path to the destination is free of any obstacles. Wash your hands, introduce yourself to the patient, and explain that you would like to help the patient to sit in a chair using a hoist. After gaining consent, put the bed brakes on and raise the bed to waist height. Select a sling of appropriate size for the patient. Check for damage and overall condition. Stand on either side of the bed with the sling ready. Help the patient to roll onto their left side. Explain what you are doing and reassure them. You must be standing next to the bed with no gap to prevent the patient from falling. The handles of the sling must face outwards, so the patient should lie on the smooth side of the sling. Roll the sling lengthways from one side and push the rolled edge firmly under the patient. Roll the patient to the opposite side and position the sling flat on the bed. The leg bands should be positioned underneath the patient's thighs. If the sling is of the correct size, the top end of the sling should be at the top of the patient's head. Check the patient's position on the sling. Move the hoist to the bed with the hanger directly above the patient's waist. The hanger should be positioned across the patient. Remember not to put the brakes on the hoist. When the patient is hanging from the hoist, it is more likely to tip over if they are on. Lower the hanger so that it is just above the patient. Hook the leg straps on the lower hooks of the hanger. Choose loops that leave no slack and use the same loops for each side so that they are the same length. Hook the body straps on the upper hooks of the hanger in a similar fashion. Now, slowly raise the hanger of the hoist until the patient's weight is completely off the bed. Remember to reassure the patient throughout the process. The patient is now hanging from the hoist. Remember to reassure the patient and to maintain good communication between the 2 carers. One carer is in charge of moving the hoist while the other carer looks after the patient, keeping them steady in the sling. Move the hoist in front of the chair and open the legs of the hoist using the handle. Position the patient directly over the chair. Lower the patient into the chair, taking care that they are positioned correctly. Once the patient is comfortably positioned in the chair, unhook the sling from the hanger. Take care, as the hanger is hazardous in this position. Remove the hoist from the area. Check that the patient is comfortable. So, to summarize, to hoist a patient into a chair, wash your hands, introduce yourself, and gain consent. Check the condition of the hoist and sling, making sure it is the right size. Place the sling in the correct position underneath the patient. Hook the sling onto the hoist. Lift the patient off the bed. Move the patient over the chair. Lower the patient into the chair and unhook from the hoist.